Arebaokeng Hospice, meaning let's nurse them, the brainchild of Flora Modiba, a professional nurse. She says she saw too many people in Tembisa suffering. But like many similar care facilities countrywide, there's no longer enough money to keep the doors open.
Most of the time we kept patients in for more than the expected time of a hospice, which was the normal time is supposed to be 3 weeks, but we kept patients for even more than 4 months because they had social problems, they had nowhere to go, and their conditions were becoming worse because with cancer, as you know, it becomes progressive. People don't get better, they get worse.
After retrenching 22 staff members, she was left with 4, including herself. 10 months later, they still managed to provide home-based care to 64 patients around Tembisa.
We have got 31 cancer patients, and for us to be of use to the community, we must be able to have at least, Tembisa has got more than 300 cancer patients.
It's a lifeline for the Ngwenya family.
Arebaokeng Hospice has helped us a lot on how to take care of my aunt. They taught us how to dress her wounds, how to administer her medication, and even gave us a wheelchair and other necessities.
With patients like this one who are suffering from cancer, they depend on Arebaokeng Hospice for care. But with its current financial crisis, it is unable to give them 100% care. It needs to hire 4 professional nurses. And all of that needs money. Sibongle Mkani-Mpolweni, SABC News, Tembisa in Gauteng.
And we find out more from our reporter Sibongle Mkani-Mpolweni about Arebaokeng. So Sibongle, let's first start with what is the status quo? What is the situation at the hospice now?
What is happening is that they had to close down the inpatient facility where they were taking inpatients that they were nursing at the hospital, because they're saying that because Tembisa is a township and there are people who have social problems, people who are staying in shacks, and those people are brought in sick, ailing with cancer by neighbors. They don't have families. Now with cancer, the situation gets worse. It doesn't get better. Now they can't just say, because the time for staying at a hospice is 3 weeks, then after 3 weeks you can go home. They have no home, so they had to take those people and keep them there. They couldn't discharge them, and that's when their funders were saying that we can't support you more because you are keeping these people here and not taking in more people instead. So what they've done is that now they are running a home-based care where they are visiting patients at home. But even that, because they had to retrench 22 staff members, now it's only 4 of them. They go to these homes with the gloves, with your gauze and medication. And with this patient that was on the story, the 90-year-old woman who's suffering from ovarian cancer, which has now spread to her lungs. She's ailing, so she's even got bed sores. So they are giving those families, they first teach the family members on how to care for that person, like how to bath her, and that every 3 hours they have to turn the patient so that they don't get those bed sores, and they gave them a wheelchair. So they're saying that there are 4 now, they are nursing 64 patients. Out of that 64, about over 30 are cancer patients, some are HIV positive patients. It's not enough, they are struggling, because they've closed the other side, but even with what they're doing now, they are struggling, they need
So let's talk
funding.
about the founder. We mentioned the fact that she founded the hospice due to a need in the community.
Yes.
Are there other options for how she could source funding? Has she said how maybe they could hopefully turn the situation around?
She's hoping that this story would be one of the things that could help. But she's knocked on all the doors. She's getting little funding from some companies, but not as much as...
Can she consider asking for state funding? Is that possible?
She's saying that when it comes to hospice, the Department of Health only gives when you have inpatient. When it comes to what she's currently doing now, there is no funding from government at all.
So what happens next? When are they likely to close their doors if the situation does not turn around?
She's saying that she won't let it get to that because those people that they are helping, the 64 patients, outpatients who are at home, are like family to them. They, you know, they grow a relationship with these people. So she doesn't want to close. She will continue, and she will continue knocking on doors, and she's seeking and asking for help so that they continue the work they're doing, because she's saying that there are just 300 people with cancer in Tembisa, and they can't help all of them with the facilities that they have. They need human resources. They need more nurses. They need about 10 healthcare givers besides professional nurses.
Did she say how people could help if they should want to come forward with help?
Yes, they can come. It is a registered NGO, so they could come and donate whatever they can donate there at the hospice in Tembisa. Then they will take it from there.
Thank you very much, Sibongle Mkani-Mpolweni.